heartfelt welcome to Public Health Nurse Linda Pierce.
Good evening. My name is Linda Pierce, and I am the public health nurse for the town of Westport. America's Heart Month isn't just for Valentine's. February's topic is American Heart Month, promoting good practices, prevention, and treatment. This is an ideal time to remind Americans to focus on their hearts and encourage them to get their families, friends, and communities involved. While American Heart Month is federally designated month of the United States, it's important to realize that cardiovascular disease knows no borders. Cardiovascular disease includes heart disease and stroke, remaining the leading global cause of death with more than 17.9 million deaths each year. Chances are we all know someone affected by heart disease and stroke, because about 2,300 Americans die of cardiovascular disease each day, an average of one death every 38 seconds. But together we can change that. Heart disease is the #1 killer in women and is the leading cause of disability among women, more than all forms of cancer. 1 in 4 women will die of heart disease, and most fail to understand the connection between the risk factors. Know your warning signs: chest pain or discomfort, upper body pain or discomfort in the arms, back, neck, jaw, or upper stomach, nausea, vomiting, lightheadedness, and cold, clammy sweats. Knowledge is power. Acting fast and acting early can reduce the unsettling statistics. Know when to call 911. About half of Americans have at least 1 to 3 risk factors for heart disease. Here are some examples: diabetes, overweight, poor diet, physical inactivity, excessive alcohol use, smoking. It causes clogged arteries and less oxygen to vital organs. Prevention: eat a healthy diet, low in salt, low in fat, low in sugar, limit your red meats, eat plenty of fruits and vegetables at least 3 times a day, fish twice a week, lean meats and poultry and whole grains. Keeping your heart healthy and your blood pressure under 120/80, cholesterol under 200, your LDL and HDL, good cholesterol, 40 to 60. Lower levels increase the risk of heart disease and are associated with diets high in saturated fats, refined carbohydrates, and sugar. Inactivity, obesity, and smoking. You'd like a ratio of 5 to 1 with your HDL and your LDL. Blood sugars under 100 fasting. A daily glass of red wine or red grapes and some dark chocolate will help. But moderation, moderation, moderation.
Yes.
Portion control: read your labels for any amounts of sugar, fats, and sodium. A healthy heart can also lower risks for dementia. Exercise helps the brain to stay healthy. People in that study were 65 years of age and older. Any questions?
I have a question if you don't mind.
Go right ahead.
Smoking marijuana, does that cause the same problems as smoking tobacco?
Absolutely.
Did you say
Absolutely.
it again?
Absolutely.
One more time?
Absolutely. You know, anything that you're putting into your lungs, that's not going to be the cure-all. I mean, I know a lot of people need it for certain pain and whatever, but any of that vaping, any smoking, any tobacco of any sort can damage your arteries. Best to stay away from it if